Hundreds of millions of people are affected by chronic respiratory diseases such as asthma, COPD, chronic sinus disease and respiratory allergy. The vast majority often don't know where to turn for credible information and are relying on untrustworthy sources such as Wikipedia and Dr. Google. This information is often inaccurate, misleading and dangerous. In today's show, we'll showcase an exciting new partnership between EUFOREA and GAAPP, the global patient platform which aims to put this right. This is EUFOREA News. Hello and welcome to EUFOREA News. I'm Dr. David Bull. Now, a report from the World Health Organization and the European Respiratory Society earlier this year revealed that chronic respiratory diseases, also called CRDs, are vastly underdiagnosed and poorly managed. They're amongst the leading causes of death and morbidity globally. The problems are manifold. Diagnostic capacity and tools remain limited, referrals to secondary and tertiary care are delayed, and the management of CRDs is suboptimal. Crucially, there is also a paucity of health information given to patients. And naturally, patients will turn to other sources to fill this void. But it is incredibly difficult for them to disentangle what is credible information from false and spurious sources. Patients are desperate to know more about the etiology, also the likely progression of their disease. They want to understand the impact the disease will have on their life and how they can manage it to the best of their ability. Given all of this, it is more critical than ever to elevate the voice of the patient. And with this in mind, a powerful new alliance has been formed to bridge the gaps in information that still exist. EUFOREA, a leader in medical innovation and science, is joining forces with GAAPP, that is the Global Allergy and Airways Patient Platform, in a landmark partnership with the aim of improving patient care exponentially. We're here to shed some light on the challenges that patients face and to tell us more about this really exciting new initiative. I'm delighted to welcome Mrs Tonya Winders, who is President and CEO of GAAPP, the Global Allergy and Airways Platform. It's really good to see you. Thanks ever so much for joining me. Now, we're talking really here about hundreds of millions of patients being affected by CRD. These numbers really are quite staggering. Very, very common problem. So why aren't patients actually being given the right information, appropriate, useful information to help them manage their conditions?
Well, thank you again for the opportunity to be here. And I think that it really does come down to where people are getting their information. So we know that, unfortunately, clinical encounters, time with doctor, is very, very limited, right? 5 to 10 minutes on average across the world. And in that time, when you get a diagnosis of something like asthma or COPD or chronic rhinosinusitis with nasal polyps, it's hard to cover all the various aspects of the condition. So people naturally are going to the internet and to their friends and family, to social media, and are not always getting the most evidence-based approaches.
So just in terms of that, and it's a really good point actually, in your role as president of GAAPP, why do you think we need to increase awareness and advocacy for chronic respiratory diseases? In many ways, it's more critical than ever, isn't it, to stand up for patients, to explain to them, to make them understand their conditions, to give them that information that's appropriate for them.
It is. So we're actually talking about almost 1 in 8, 1 billion people on the planet living with chronic respiratory disease and or immunological conditions that we represent. And so it's very important that this be prioritized by governments and that, again, we get the allocation of funding and education, of research to advance care in these areas. They have long been underfunded, under-recognized, and under-prioritized by most governments across the world.
So, given that you talk to patients the whole time, what's the most pressing need that you see?
Well, I think that it's hard to come up with one pressing need for all patients. Again, it's a lot of people with a lot of different needs. But it really does come down to number one, having a trusted partner in their healthcare journey, and that provider that can help guide them to the right direction and support them along their journey. Understanding that greater than 99% of their care will be outside of the clinic, outside of the hospital. And so partnering with someone who points you in the right direction for that long-term support and management after you're diagnosed is very important.
With that in mind, of course, you're here today to make a major announcement, of course, the partnership with EUFOREA. What do you think this specific alliance unlocks for GAAPP and also for the patient community themselves?
So I think that for GAAPP, this is a very important partnership with EUFOREA. EUFOREA has been a recognized leader in this space of airways diseases for so long. And so having this formal partnership between GAAPP and EUFOREA demonstrates that there is a shared mutual respect among the healthcare provider community and the patient community. Secondly, I think that this gives us a unique opportunity to not only work together, but to co-create and develop assets and resources that will meet people exactly where they are in their journey.
And really, I suppose underpinning this is actually the idea that collaboration between medical organizations and patient organizations really is the crux to getting better patient care, isn't it?
I absolutely think it is. I think it's also the crux and the epitome of how we go to governments and speak in one collective voice to prioritize this with policymakers.
Now, I was reading that you and your organization talk about advocacy beyond borders. What do you mean by that? What do you define by that? And also, I suppose, how do you envisage that in reality and in practice?
Well, the reality is that the world is a much more global landscape. So we know that policy is made quite locally at the hospital, at the community level, but that it's important to have consistent global policy. So we've been working with the World Health Organization, with the United Nations General Assembly, and with other policymakers across regions of the world to ensure consistency of policy and access to appropriate timely diagnosis, treatment, and long-term management of chronic respiratory diseases.
Well, I think it's an amazing partnership. I wish you a great deal of success with it. Thank you very much indeed for your time. That's Mrs. Tonya Winders.
Thank you.
Well, let's now talk to Dr. Xander Bertels. He is EUFOREA's Head of Advocacy and Adapt Medical Liaison. Really good to see you once again, Xander. Now, I mentioned there that you are the medical liaison for Adapt, which obviously is a EUFOREA innovation. Can you just remind us what exactly that is?
Sure. No, thanks for having me, David. So Adapt is the Airways Disease Action Plan for predictive and personalized treatment. And that's a highly needed project because of the huge burden, which you, as you mentioned earlier, of CRDs in general, be it upper or lower airway diseases. They both have a huge burden on morbidity, on socioeconomic impact, on mortality. And to understand this project, we need to take one step back and look at other therapeutic areas. If you look at IBD or if you look at dermatology, they often use a strategy, what they call is hit early, hit hard. And why is that important? Well, they know very well that early disease modification, it prevents irreversible outcomes in their patients. And the same might be true for airway diseases, because we see also with delayed diagnosis, with delayed proper treatment, there is a lot of irreversible damage that can be prevented. But it is somewhat neglected, unfortunately. But with the latest sort of therapeutic targets that we have, mainly remission, I think it's highly needed to build a platform that can guide patients in their journey, that can provide personalized recommendations and get to that remission as soon as possible if that's a possibility. And EUFOREA has been busy with this plan. And with the first step was obviously the patient educational portal that has been launched now for CRS as well as for asthma. And in the next step, this project will be built upon further.
Now, I was just talking to Mrs Tonya Winders about this partnership between EUFOREA and GAAPP. We heard from her the powerful patient perspective. So from your side, from the medical side, what does EUFOREA bring to this partnership?
Well, EUFOREA has always had a sort of dual approach, where we have on the one hand top experts in their field, and on the other hand, we always had a patient advisory board guiding us with talkative patients with a long patient journey that know where the critical things go wrong and where things need to be better. So for us, it's very natural to work together with patients as a medical society. And the unique sort of USP of EUFOREA has always been to provide busy clinicians with guidance. So not only providing evidence, but real guidance so that it makes it easier for them to treat their patients in the best optimal way. And that's, of course, quite a specific niche that we cover in the medical field of chronic respiratory diseases. And I think GAAPP has been very welcoming to us to work together, because it's also very aligned with their strategy. So I think the partnership between EUFOREA and GAAPP is something that might really change the field, and I hope that it will.
What do you think is the most critical issue that the two of you, EUFOREA and GAAPP, will have to tackle?
The most critical issue for me is still the lack of patient-centered care. And that's, of course, a really broad, general thing to say, but it has really important practical implications. And for me, the immediate focus to address this issue would be breaking down the silos. And that's something that EUFOREA has been busy with for now over 10 years, breaking down the silos between upper and lower airway diseases. So a lot of things have grown historically, with ENT physicians being trained as surgeons, pulmonologists being trained as internal medicine specialists. So breaking down that silos is really important and something that EUFOREA does best. And well, that's needed because we should not treat patients as separate organs, but as one whole. And that's also what GAAPP has been advocating for many years now. So that's, for me, that's the most critical issue, to break down those barriers for better patient-centered care.
Finally, look, this sounds like a fantastic partnership. How do you measure success?
How do I measure success? For me, success would be the implementation in real life. So any solution that really works in practice is, for me, the main measure of success. And that can only be done, I think, if both clinicians and both patients embrace those solutions. So intelligently designing that, amongst others, through ADAPT, I think is the way forward. And for me, the most important marker of success, because the field is moving, but it's moving too slow. And for me, if we can get faster diagnosis, more personalized care, faster referral for any uncontrolled patients, getting to that stage that disease are controlled and are going to remission in airways diseases, I think that's the most important marker of success. And in the end, that means that adequate medical therapy is available to most, if not all, patients, hopefully at a certain point of time. So that's, for me, the main outcome of this collaboration. Yeah.
Xander, it's always really good to talk to you. Thank you very much indeed. That's Dr. Xander Bertels.
Thank you so much.
Well, there you have it, a really exciting initiative from EUFOREA and GAAPP, the launch of something really exciting and innovative that will have a positive impact for patients suffering from chronic respiratory diseases. Many thanks to my guests, to Mrs Tonya Winders and also to Dr. Xander Bertels. Now, you can find more information about EUFOREA and also register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. Also, we are on social media. Please do follow us. We're on YouTube, X, LinkedIn, Spotify, Instagram and Facebook, literally everywhere. Until next time, goodbye.